Clinical chemistry, trace and toxic elements. Essential trace elements are considered essential if a deficiency impairs a biochemical or functional process and replacement of the element corrects impairment. They're often associated with an enzyme, metalloenzyme, or another protein, metalloprotein, as a cofactor. Excess concentrations are associated with some degree of toxicity. Trace elements are iron, copper, and zinc. Ultra-trace elements include selenium, chromium, and manganese. Non-essential trace elements are of medical interest because many of them are toxic. Sample collection and processing. Specimens must be collected with scrupulous attention to details such as anticoagulant, collection apparatus, and specimen type. Elements are of low concentration in biologic specimens and ubiquitous in the environment. Much care must be taken to avoid contaminating specimens. Special sampling and collection devices, specially clean glassware, water, and reagents of high purity must be used. The lab environment must be carefully controlled. Placement of trace elements in the lab in separate room, use of sticky mats at doors, non-shedding ceiling tiles, controlled airflow, and disposable booties. Atomic emission spectroscopy. Three most important components of AE spectrophotometer: the source, sufficiently hot to produce excited state species; wavelength of selecting device for spectral dispersion of radiation and separation of analytical line from other radiation; detector, permitting measurement of radiation intensity. Liquid sample containing element is converted into an aerosol and delivered into the source where it receives energy to emit radiation. Intensity of emitted radiation is correlated to concentration of an analyte and is basis for quantitation. This is a schematic of an AES. So you can see the flame or plasma light emission, the monochromator, and the detector. Atomic absorption spectroscopy, an analytic procedure for quantitation of elements through absorption of optical radiation by free atoms in the gas phase. Spectra of atoms are line spectra, specific for absorbing elements. Three most important components of AA spectrophotometer: a source in which a sample is atomized at a sufficient temperature to produce an excited state species. Those species will emit radiation upon relaxation back to the ground state. A wavelength selecting device, monochromator, for the spectral dispersion of the radiation and separation of analytical line from other radiation. A detector permitting measurement of radiation intensity. So this is a simplified schematic of an AAS instrumentation. Inductively coupled plasma mass spectrometry, a state-of-the-art analytical technique for elemental analysis. Measures mass-to-charge ratio of selected analyte ions. Includes ion source, MZ analyzer, and ion detector. Argon plasma is introduced by ICP instruments, generates high temperature, about 6,000 to 10,000 Kelvin, and serves several purposes. It dries droplets produced by the nebulizer, vaporizes dried particles, atomizes any molecular species, thermally ionizes atoms, and a simplified schematic is given in figure 18.4. The typical mass spectrometer used for ICP-MS is a quadrupole mass spectrometer. The analyzer consists of our parallel conducting rods arranged in a square array. Other ICP-MS instruments incorporate high-resolution mass spectrometers. These are usually double-focusing sector field instruments. Such instruments are separate ions of different MZ values via deflection in a magnetic field, with ions of greater MZ being deflected to a lesser degree than those of lower MZ. Interferences, spectroscopic, results from spectral overlap with spectrum of target analyte. ICP-MS spectral interferences, polyatomic species whose MZ may overlap an MZ of a target analyte. Spectral interferences arise from nearby elements in the periodic table, and doubly charged ions. Non-spectroscopic interferences, matrix interferences, or anything interfering with atomization. Elemental speciation. Because toxicity of an element may vary by its chemical form, methods are needed to identify specific chemical forms. Hyphenated analysis is a combination of complementary analytic techniques to measure a specific form of analyte. Liquid chromatography, ICP-MS. Alternative analytic techniques, neutron activation analysis, voltammetric methods, ion chromatography, gas chromatography, mass spectrometry, laser ablation, ICP-MS. Now we're going to go into a few of the metals that can have some toxicities. So aluminum is used for beverage cans, pots, pans, airplanes, siding, and roofing and foil, also found in consumer products such as antacids, astringents, buffered aspirin, food additives, cosmetic, and antiperspirants. Approximately 1.5 to 2% of inhaled and 0.01% to 5% of ingested aluminum are absorbed. The absorption efficiency is dependent on the chemical form. The health effects include interference with enzymatic processes. Signs and symptoms of aluminum toxicity include encephalopathy, osteomalacia or aplastic bone disease, proximal myopathy, increased risk of infection, microcytic anemia, increased left ventricle mass, and decreased myocardial function. It's measured primarily by ICP-MS or GFAAS. Arsenic. Current and past use of arsenic include pesticides, pigments, poison gases, ammunition manufacturing, semiconductor processing, and medicines. Absorption, transport, and excretion. Exposure is ingested in food like seawater or seafood, water, drink, or it's inhaled. Non-toxic organic forms clear rapidly. Toxic inorganic forms clear slowly. Health effects, non-essential, no known function in human physiology, and it is toxic. Toxicity, exposure can lead to acute and chronic intoxication. Inorganic form produces symptoms and can be lethal. Organic species are relatively non-toxic. Primarily measured using ICP-MS, GFAAS, or HGAAS. Cadmium. Principal industrial uses of cadmium include manufacture of pigments and batteries, as well as in metal plating and plastics industries. In the United States, the burning of fossil fuels such as coal or oil and the incineration of municipal waste materials constitute the largest sources of airborne cadmium exposure. Absorption, transport, and excretion. Exposure, inhaled in tobacco smoke and ingested in food. Absorption, 10 to 50% inhaled, 5 GI, excretion, 90% in feces. Health effects, it's non-essential, there's no known function in human physiology, and it is considered toxic. Toxicity includes renal dysfunction, nasal epithelial and lung damage, and respiratory distress. Nausea, vomiting, abdominal pain if ingested in great amounts. It's quantified by GFAAS and ICP-MS. ICP-AES is also used. In blood, cadmium is found mostly 70% in red blood cells. Chromium. Occupational exposure to chromium occurs in wood treatment, stainless steel welding, chrome plating, the leather tanning industry, and the use of lead chromate or strontium chromate paints. Absorption, transport, and excretion. It's absorbed, bound in blood to transferrin, transported by albumin. Health effects, it is essential. It helps maintain the metabolism of glucose and fat and cholesterol. Deficiency or toxicity. Deficiency includes glucose intolerance, glycosuria, hypercholesterolemia, decreased longevity, decreased sperm counts, and impaired fertility. Toxicity includes dermatitis, skin ulcers, eczema, cutaneous contact, airway irritation and obstruction, and lung cancer if inhaled. It's determined by GFAAS, NAA, or ICP-MS. Copper, soft yet tough metal with excellent electrical and heat conducting properties. Copper is widely distributed in nature, both in its elemental form and in compounds. Copper forms allies with zinc to make brass, tin to make bronze, and nickel, cupronickel, widely used in coins. Absorption, transport, and excretion. Exposure, if it's ingested in food, about 10 milligrams per D. Absorption, 50 to 80% of dietary intake. Excretion, 50% of dietary intake in feces, 3% in urine and sweat. Health effects, it is essential. It's a component of several metalloenzymes. Deficiency includes neutropenia and hypochromic anemia, osteoporosis, decreased pigmentation of the skin, and general pallor. Toxicity includes Wilson's disease, neurological disorders, liver dysfunction, Kayser-Fleischer rings in the cornea. It's measured by flame AAS, ICP-MS, ICP-AES, and ASV. Iron is the fourth most abundant element in the Earth's crust and the most abundant transition metal. Absorption, transport, and excretion. Exposure, it's ingested in food, must be reduced to Fe2 for absorption. Absorption, 10% of dietary intake and transport is carried by transferrin to the bone marrow and incorporated into hemoglobin. Deficiency and toxicity. Deficiency is anemia. Toxicity is tissue accumulation, liver function, hyperpigmentation. Health effects, it is essential. It's a component of hemoglobin and myoglobin. Disorders of iron metabolism are evaluated primarily by packed cell volume, hemoglobin, red cell count, and indices, total iron, and TIBC, percent saturation, transferrin, and ferritin. So going into iron in a little bit more detail, because this is essential, and this is something that's going to come up in hematology as well. So we have intestinal absorption, and then it goes into the plasma or extracellular fluid. From there, it gets transferred through transferrin to the bone marrow, where you have erythropoiesis or heme synthesis, and it's incorporated into hemoglobin. Then it's carried by erythrocytes through the blood. When those blood cells are destroyed, phagocytes are going to release the iron after destruction of hemoglobin metabolism, and then the iron that's excess can also be stored by ferritin or hemosiderin. And this is a more detailed diagram that you can look through to look at the pathways of iron and the regulation of iron metabolism. Just clicking through some of these animations here. So proteins involved in iron metabolism. Ferritin is the storage form of iron. Apoferritin is a protein shell. It surrounds a crystalline core of many iron atoms, such as ferric oxyhydroxide or ferric hydroxyphosphate. It's present in most cells and readily metabolized. Iron stores released as Fe+2. Hemosiderin is an insoluble complex derived from ferritin that has lost some surface protein and become aggregated, 1 to 2 micrometer diameter particles, and it's visible by light microscopy after staining with Prussian blue. Iron deficiency results in anemia. So if we have depletion of iron stores, we have anemia. It develops in stages. Depletion of iron stores in response to prolonged negative iron balance. Drop in hemoglobin concentration. Red blood cells become smaller, paler than normal. Fully developed iron deficiency anemia has decrease in hemoglobin. All red blood cells indices are decreased, so mean corpuscular volume, MH or MCH, MCHC. Blood smear shows hypochromic microcytic red blood cells with abnormal variation in size and shape. No visible iron in the bone marrow, and hemosiderin by Prussian blue stain. Iron overload, you have hemosiderosis. Iron overload without associated tissue injury. Hemochromatosis is iron overload with associated tissue injury. You have cellular degeneration, fibrosis. There's hereditary and acquired forms, typically due to chronic excessive absorption from a normal diet. Sideroblastic anemia is a group of iron overload disorders of unclear mechanism. Hereditary and acquired forms. Hereditary, deficiency of ALA synthase in red blood cells. Iron accumulates in the mitochondria because of metabolic bottleneck. Laboratory measurement of iron. Serum iron is measured by a variety of techniques. Photometry, atomic absorption spectrometry. Reference levels are method dependent. Through modification, total iron binding capacity, TIBC, and serum transferrin can be determined. General principle, decreased pH releases iron from transferrin, reduce Fe3+ to Fe2+. Fe2+ forms complex with chromogen, and then there's different absorbances that they can be measured at. Unsaturated iron binding capacity. Add sufficient iron plus 3 to saturate transfer and binding sites. Remove excess iron and assay is repeated. TIBC is calculated, UIBC plus the serum iron. Serum transferrin, you can determine through that calculation. Changes in TIBC, an increase would indicate iron deficiency, hepatitis, pregnancy, oral contraceptives, and decrease in malignancy, inflammation, nephrotic syndrome, malnutrition, megaloblastic hemolytic anemias, and hemochromatosis. And this is just a picture showing serum iron and TIBC in various conditions. You can take a look at this. Serum ferritin is determined by immunologic methods. Plasma concentrations decrease very early in iron deficiency, and it's a sensitive indicator of iron deficiency, uncomplicated by other factors. It's increased in a variety of chronic diseases, chronic infections, inflammatory disorders, heart disease, malignancy, especially leukemias, lymphoma, breast cancer, and neuroblastoma, viral hepatitis, toxic liver injury, hemosiderosis, or hemochromatosis. This is a table that you can take a look at, and you can look at different disease stages and the reference range for the various compounds and whether it's increase, decrease, or normal. So spend some time reviewing this table. Analysis of analytes, so spectrophotometry, bilirubin, we talked about previously in this class. PGB, ALA, the chromogen, you use Ehrlich's reagent. Hemoglobin, the chromogen, you use potassium ferrocyanide. Fluorometry, porphyrin screen, protoporphyrin, variegate porphyria, uroporphyrin, free erythrocyte protoporphyrin, or zinc protoporphyrin. And then this shows coax symmetry. And going on to lead. Lead is used in the production of storage batteries, ammunition, solder, and foils. Once used extensively as an additive in gasoline, we also know that it used to be added to paint. Present in many paints manufactured before 1970. Absorption, transport, and excretion. Exposure, the respiratory and gastrointestinal. Absorption is 30 to 40% inhaled, variable in GI, and then excretion, 76% in urine, 16% in feces, 8% in hair, sweat, and nails. Toxicity, children IQ declines, clumsiness, gait issues, headache, behavioral changes, seizures, cognitive and behavioral problems. Adults, peripheral neuropathies, motor weakness, chronic renal insufficiency, systolic hypertension, and anemia. Health effects, it's non-essential, there's no known function in human physiology, and it is toxic. Mercury is released to the atmosphere as a product of the natural degassing of rock, 30,000 tons per year, and through various human activities, 20,000 tons per year. It's used in dental amalgams, electronic switches, germicides, fungicides, and fluorescent light bulbs. Absorption, transport, and excretion. Exposure is through inhalation, ingestion, primarily fish, cutaneous injection, tattoo pigments, and dental amalgams. Absorption, 80% inhaled, about 0% in the GI, and excretion, fecal and urinary. Toxicity, primarily through reaction with sulfhydryl groups. Inhaled vapor causes nervous, digestive, and immune system issues. Inorganic salts, skin, eyes, GI tract, and kidneys. It's non-essential, there's no known function in human physiology, and it is toxic. Mercury intoxication can manifest in many signs and symptoms that affect several organ systems, including headache, tremor, impaired coordination, abdominal cramps, diarrhea, dermatitis, polyneuropathy, proteinuria, and hepatic dysfunction. It's measured by ICP-MS and cold vapor atomic absorption spectroscopy. Mercury used to be a common component of certain types of thermometers as well. So if you use a mercury thermometer and it's glass and it breaks, then you can have exposure that way as well. Manganese. All elemental manganese is used in the production of alloy. Ferromanganese, widely used in steel production. Scavenger role in copper and aluminum alloys and in production of dry cell batteries. Various manganese compounds are widely used in fertilizers, animal feeds, excuse me, pharmaceutical products, dyes, paint dryers, catalysts, and wood preservatives, and in production of glass and ceramics. Absorption, transport, and excretion. Absorption, 2 to 15% of dietary intake affected by iron, calcium, phosphates, and fiber. Deficiency includes blood clotting defects, hypocholesterolemia, dermatitis, heart and bone problems, and stunted growth in children. Toxicity includes nausea, vomiting, headache, disorientation, memory loss, anxiety, compulsive laughing, or crying. Health effects, essential, a component of metalloenzymes, an enzyme activator. It's measured by ICP-MS and GFAAS. Molybdenum, production of alloys as well as catalysts, corrosion inhibitors, flame retardants, smoke depressants, lubricants, and molybdenum blue pigments. Absorption, transport, and excretion. Absorption, 25 to 80% of dietary intake. Excretion, urine and bile. Deficiency, an inherited disorder, causes seizures, anterior lens dislocation, decreased brain weight, and death prior to age 1. Toxicity is rare. It's linked to elevated uric acid in the blood and increased incidence of gout. It is essential and it's a component of at least 3 enzymes. It's measured by ICP-MS and GFAAS. Selenium. Processed selenium is used in the electronics industry. However, other uses include nutritional supplements, pigments, pesticides, rubber production, anti-dandruff shampoos, and fungicides. Absorption, transport, and excretion. Exposure through food and drinking water. Absorption, greater than 50% of dietary intake. Excretion, urine, feces, sweat. Health effects, it is essential. It's part of cellular antioxidant defense system against free radicals, and it's involved in the metabolism of thyroid hormones. Deficiency includes cardiomyopathy, muscle weakness, and osteoarthritis. Toxicity is rare, only from one form of selenium, not present in food, causes nausea, vomiting, hair loss, nail changes, and diarrhea. It's determined by ICP-MS or GFAAS. And zinc. Production of alloys, especially brass, with copper, in galvanizing steel, in die casting, in paints, in skin lotions, and treatment for Wilson's disease, and in many over-the-counter medications. Absorption occurs mainly by the small intestine. In blood, zinc is distributed between red blood cells 80% and white blood cells 3%. Excretion 90% in feces. It is essential and influences greater than 300 enzymes in synthesis of metabolism of proteins. It participates in glycolysis and cholesterol metabolism. Deficiency is widespread, causes growth retardation, slow skeletal maturation, testicular atrophy, and reduced taste perception. Toxicity, GI tract symptoms, decreased heme synthesis. This is also recommended to be taken as a vitamin supplement in the treatment of COVID and other types of viral infections. Measured by flame AAS, ICP-AES, and ICP-MS.